Welcome everyone. We're gonna see this case on neuroimaging. So this case belongs to a 6-year-old female spayed greyhound that present with peracute onset of the following clinical signs. So we're gonna observe the video, and we have to observe the mental status and the behavior, evaluate the posture and the position, the body position at rest, the gait, and see if there is any abnormal involuntary movement. When we put our hands on, let's focus on the postural reaction tested. Let's see the spinal reflexes, the muscle mass, and the tone, the cranial nerve assessment, and then what I would evaluate by the end is the palpation and the area of pain of discomfort. So not all the parts of the neuro exam are on the video, but we will list the findings on the following slide. I just want you to see the video so you can evaluate the posture, the mental status, where the dog appeared quite disoriented. He had a little bit of Y-based stance, but overall he had this increased tone in the neck, so he had this opistotonus. And then when he was going on lateral recumbency, you can see that increased tone on the thoracic, and a very disoriented patient with this absent postural reaction. So another thing that we've saw on this patient is that also had this mydriasis on the left eye with wide palpebral fissure. So if we put all together, what do we have? We have a patient that presents with peracute onset of disoriented mental status. If we evaluate the posture, it had increased tone on the thoracic, increased tone on the pelvic, but a little bit more flex than the thoracic. It had this opistotonus, so it had this increased muscle tone in the neck. It was, as I said, disoriented. The evaluation of the gait was difficult because as soon as the posture of the dog was changed, the dog was getting very uncoordinated, and overall you could see it was getting quite stressed. So on those patients, it's better than not to try to evaluate the gait if you really cause stress on it. And then when we evaluate the postural reactions, you can only see the thoracic, but there was decrease on all four. Spinal reflexes were all normal on all four limbs, but we could see an increased muscle tone. And then when we evaluate the cranial nerve assessment, what we saw was a pathological nystagmus, more like a vertical type of nystagmus. There was decreased menace response bilaterally, but with normal vision. And as you saw on the picture, there was a mydriasis on the left eye with wide palpebral fissure. Then there was not pain on manipulation. So if we have to put all together, then we have to try to neurolocalize based on this information. And then, do you see any signs of lateralization? Can we go more for right or left? So thinking on putting all together, as we said on the previous case last week, it's important that we use our clinical reasoning. So prior to make our list of differential diagnosis, we need to think about the signalment. So we have this 6-year-old female spayed greyhound that presented with peracute onset of an acute, non-progressive, no very obvious signs of lateralization, no pain with your neurolocalization, which I'm not going to say. And then again, let's think about the list of differentials. Fraser will present the middle of the week the imaging findings, and then we will discuss our neurolocalization and the outcome of the patient at the end of the week. But also try to think based on the findings, the treatment that you could offer and the outcome that you would expect in this patient. So thank you so much, and let's get in touch by the end of the week.